The Adductor Magnus muscle. The adductor magnus is the largest of the muscles in the adductor group. It's located deep along the inside of the thigh, and it's sandwiched between the hamstring muscle group on the back of the thigh and the quadriceps muscle group on the front of the thigh. This muscle is typically active during the heel strike phase of walking and running. It's also active while walking upstairs, but is not involved when walking downstairs. Let's look at the landmarks. First, we have the femur and the sacrum, the pelvis, and in green, you can see the origin of the adductor magnus on the ischial ramus and the ischial tuberosity of the pelvis. And in purple, we have the insertion of the adductor magnus along the linea aspera and to the adductor tubercle of the femur's medial condyle. And now we look at some of the muscle attributes. Contraction of the adductor muscle produces adduction of the thigh at the hip, and also medial rotation of the thigh at the hip. The synergistic muscles for the adductor magnus include the other smaller adductors, both for adduction and medial rotation. And the antagonistic muscles for adduction, they're the gluteus medius, the gluteus minimus, and the tensor fasciae lata. And for medial rotation, the antagonistic muscle is the gluteus maximus. Let's take a look at the clinical findings for adductor magnus trigger points. Clients with these trigger points will typically complain of intrapelvic pain that they describe as deep inside the pelvis, rectal pain, vaginal pain, or testicular pain, inner thigh pain and groin pain, and the cramping type of pain that's usually associated with PMS. Some factors that may activate adductor magnus trigger points include slipping on ice or roller skates, skiing or rollerblading, long bicycle trips, osteoarthritis of the hip, running uphill or downhill, and sitting in a fixed position for a long period of time, such as when they're driving or sitting with their legs crossed. Clients with adductor magnus trigger points typically also have active trigger points in the vastus medialis, and although they're not listed here, I will usually find active trigger points in the hamstring muscle group as well as the abdominal obliques. Some common misdiagnoses for adductor magnus trigger points include pubic stress symphysitis, pubic stress fracture, and a syndrome called adductor insertion avulsion syndrome.